Hello, my name is Micaiah Morrow, and my fall prevention program is Stepwise in Bowling Green, Kentucky. So our motto is going to be strength, safety, stability for every step. It's going to be hosted in Bowling Green, Kentucky, again, like I said, and we're going to be focused more so on those senior living facilities because they host 65 plus. We see that by statistics that Bowling Green is a heavy area for those that are elderly that have falls, and we want to be able to reach this community where they're at to prevent these deaths and to help with that older population that's very prevalent in Bowling Green, Kentucky. So our USPTF recommendation for our grade B is going to be exercise interventions that offer a moderate net benefit in reducing falls and fall-related injuries among older adults and at risk. Our program that is already implemented in the United States is the Otago Exercise Program. It is a home-based PT-led program that has been shown to produce effects from 35 to 40%. It is recommended for older adults and can be implemented in the outpatient and the inpatient settings and within the community, so like parks and things like that. While it is effective, PT is going to be it requires availability and consistent follow-up, so it'll be a weekly basis. Um, the grade C is a multifactorial intervention which combines exercise, medication review, vision correction, and home safety assessments. It offers a small net benefit and should be tailored to individual needs. So, a program that's already placed that's like grade C is the CDC Set Steady Toolkit. It is a clinical framework that is used by the healthcare providers to screen, assess, and intervene in fall risk. Includes training for the patients, patient education, referral tools, and its success depends on the provider's engagement with it. So for our planning and decision making, we're going to have our program priorities are going to be based on research center data, local ER visits, and the USPSTF guidance. Our SMART goals are going to include reducing falls related ER visits by 20% in 12 months and achieve 75% retention over the 6 months. Our organizing and staffing is pretty straightforward. We're going to have paid staffing like physical therapists, health educators, centers coordinators, local clinics and primary care providers, and we're going to have unpaid volunteers for outreach and logistics, such as interns. We're going to do this by our engagement. We're going to recruit through Western Kentucky University. We're going to talk to senior citizens to get our senior centers to get our program out to senior citizens and have local coalitions like with the Barren River Health Department. We're going to have training stipends like gift cards you can get for coming, recognition events, and community impact storytelling so that we can get the word out about how our program is impacting. Leadership and coordination is weekly coordination meetings with dashboards that are going to be shared throughout the program, steering a committee led by Bowling Green Warren County Health Department so that we have somewhere to host our meetings and be a more welcoming environment. Our controlling and budgeting is pretty straightforward and simple as well. We have our major budget core categories: staffing, training, and PT services, equipment, and outreach materials and transportation. And then our funding sources is going to come from the Kentucky Department of Public Health grants, the Medical Center Health sponsorships, local foundations, and senior advocacy group. And we're going to show our accountability through monthly reporting, participant feedback, and fiscal audits after the year is done. So our evaluation and recommendations are going to be measured through 20% reduction in fall-related ER visits within the 12 months, 75% participant reduction over the 12 months. And our evaluation method are going to be pre-post surveys, incident tracking via clinical reports, stakeholder interviews, and quarterly program reviews. Also, we're going to be able to track our budget as well. So another recommendation that we have is to expand home safety assessments from trained volunteers, to integrate fall risk screenings into routine primary care visits, and increase outreach in underserved neighborhoods. So this project demonstrates the five core administrative functions of public health. So we're going to have our planning, the grounded in local data and national guidelines, so that the program is clear, measurable goals, organizing with strategic partnerships and defining roles to ensure efficient implementation, staffing for recruitment and motivation strategies to foster a committed workforce, leading, coordinating leadership across sectors, promoting sustainability and impact, and controlling with budget oversight and outcome tracking, maintain accountability and transparency. Thank you very much. And here are my references.